If you're a woman over 40 who wakes up at 2:30 in the morning with your mind racing, you're exhausted, the scale keeps creeping up, you're snapping at the people you love, and yet your doctor keeps telling you that everything looks normal, this video is for you. I'm Dr. Renee, a double board certified OB/GYN and functional medicine doc, and I work with women who feel anything but normal, even when their labs say they are. Did you know that your doctor could be missing up to half the lab markers that actually explain your symptoms? I can't count how many women over 40 come to me feeling exhausted, gaining weight, or just feeling off. And their doctor says, everything looks fine. We'll see you next year. Here's the problem. Most routine labs only scratch the surface. They're designed to catch disease, not to tell you why you feel like a stranger in your own body. So in this video, I'm going to walk you through 8 key tests I check in every woman I work with so you can start getting real answers, not just a pat on the back. And if you want to go deeper, I've put together a full lab guide with 15 total markers I look at for every woman over 40. You can grab that in the description below. So now let's get into it. Number 1, a full thyroid panel, not just a TSH. If you've been dragging yourself through the day, watching that scale creep up, watching the weight gain around your middle, your hair is starting to feel thinner, and your brain just isn't as sharp as it used to be, this is where I start to look at your thyroid differently. What is usually done? Well, most doctors only check a TSH. That's just the signal from your brain to your thyroid. It doesn't tell us if your thyroid is actually producing enough hormone or converting it into the active form that your cells can actually use. Thyroid issues are incredibly common in women over 40, and autoimmune thyroid, also known as Hashimoto's, is often completely missed because antibodies aren't checked. So what do I look for? I order a full thyroid panel, TSH, free T4, free T3, reverse T3, and thyroid antibodies, namely thyroid peroxidase and antithyroglobulin antibodies. I want to know if stress, inflammation, or nutrient deficiencies are contributing to subclinical hypothyroidism. And I always check antibodies to rule out autoimmunity. Just this week, I found a brand new case of Hashimoto's in a client who was told that her labs were completely normal. That matters because if your thyroid isn't working optimally, you're going to feel tired, heavy, foggy, and just not like yourself, even if your TSH is normal on paper. So an optimal TSH, I usually aim for between 1 and 2. You want your free T3 in the upper third of the lab range. And of course, you want your antibodies to be negative. Next up, we have ferritin. If you're exhausted, no matter how much you sleep, if it feels like your hair seems to be shedding more than usual, and you just feel weak or flat, ferritin is one of the first markers I want to see. What do most doctors do? Well, most of the time, ferritin is only checked if your CBC, your complete blood count, already shows that you have anemia. That misses a huge window where you feel awful but don't technically meet criteria for anemia. So what do? I check ferritin routinely as your iron storage marker. That matters because low ferritin can cause fatigue, hair loss, and brain fog even if your hemoglobin is normal. And on the converse, high ferritin can be a marker of inflammation and metabolic stress. For most women, I like ferritin around 70 to 100 nanograms per ml. Both too low and too high deserve attention. So if your ferritin is elevated, we need to dig into why, not just ignore it. Next up, we have vitamin D. If your mood's been low, if you're getting sick more often, or you're starting to worry about your bones and overall resilience as you get older, vitamin D is a big one, especially if you live in a cold weather climate or wear sunscreen at all times when out in the sun. Most docs don't routinely check vitamin D. Other times it's considered fine if it's barely in the normal range. On the flip side, I have seen women supplementing aggressively and ending up with levels that are way too high. So what do? I check a vitamin D level and interpret it through a functional medicine lens. That matters because vitamin D is a powerhouse for your immune system, bone strength, hormone balance, and your mood. I generally aim for an optimal range between 60 and 80 nanograms per ml. And I've actually seen women come in fairly recently, 2 in a row, over 100, which can be risky. You have to know more is not always better. So this is one you're going to want to monitor with a provider, especially if you're taking high doses. Next up, an advanced lipid panel, including Lp(a) and ApoB. If you have a family history of heart disease or stroke, or you're noticing weight shifting to your midsection, and you're wondering what that means for your heart health, a basic cholesterol test is not enough. Most doctors just run a basic cholesterol panel, your total cholesterol, LDL, HDL, and triglycerides. That gives a rough overview, but misses important risk markers. So I'll start with a basic cholesterol panel on most of my clients, but then on repeat labs, I will order an advanced lipid panel that includes an ApoB, which is a better marker of the number of bad cholesterol particles that you have, and an Lp(a), which is a genetic marker that can significantly increase cardiovascular risk. That matters because heart disease risk rises after 40, especially for women. And we often don't get the same early warning signs that men do. So when it comes to optimal levels, ApoB I generally like under 80, and Lp(a) I want as low as possible, ideally under 30 milligrams per deciliter. I'm not just looking at total cholesterol. I'm looking at the quality and type of particles to understand your true risk. Next up, we have a fasting insulin. If you feel like you're doing all the right things and the weight around your middle just won't budge, you're most likely riding the blood sugar roller coaster with cravings and crashes, and you're going to want to think about getting a fasting insulin. Now, most docs get a fasting glucose or maybe an A1C, but fasting insulin is rarely checked. That means early insulin resistance can be missed for years. I see this all the time. So what do I do instead? Well, I check a fasting insulin alongside a fasting glucose and a hemoglobin A1C. That matters because insulin tells me how your body is handling sugar. Now, I generally like an optimal level between 2 and 5. Now, if it's too high, that's going to tell me you're at risk for early insulin resistance, diabetes, and weight gain, as well as metabolic issues. And I've actually recently seen it really, really low, like almost non-detectable in some women on high doses of GLP-1 medications. Now, this is a problem too because your body needs insulin to function. We're aiming for balance here, not extremes. Next, I check a high sensitivity C-reactive protein. If you're feeling puffy, inflamed, achy, and generally just off in your body, even if no one can find anything wrong with you, I want you to know what your inflammation is doing, and this might be the test to tell you that information. So what do most doctors do? They don't even look into inflammation until you have a clear disease process already going on. But here's the reality. Low-grade chronic inflammation that makes you feel off is rarely discussed. So I actually go looking for it. I check a high-sensitivity C-reactive protein, which is a high-sensitivity marker for systemic inflammation. That matters because chronic low-grade inflammation can drive things like weight gain, mood changes, hormone disruption, increase cardiovascular risk. So you want to make sure that you are keeping an eye on it. And ideally, we want it under 1 milligram per liter. Even a mild elevation can be a clue that something in your lifestyle, gut, hormones, or environment needs attention. Next up, we have a comprehensive hormone panel. If your mood is all over the place, you're waking up at 2:30 in the morning with your mind racing, your periods have changed, or your libido has disappeared, that's my cue to look at your hormones and cortisol pattern more closely. And a little reality check here. Most docs, even OBGYNs, don't care about checking your hormone levels. They might check an estradiol if they're forced to do so, maybe an FSH if we're talking about menopause. If labs are drawn, a lot of times they're random without context. If they check a cortisol, it's in the blood, checked in the morning, even if they check it, which is, again, not usually done. So what do? I use a comprehensive hormone panel, which includes things like estradiol, progesterone, total and free testosterone, DHEA. And when it comes to cortisol, I actually prefer salivary cortisol throughout the day to see your stress hormone pattern, not just a single snapshot first thing in the morning in your blood, because that pattern matters more as far as how we're going to create your protocol. And listen, hormones are nuanced. There is no one size fits all perfect number. So the optimal ranges for each of the different hormones is going to depend on your age, whether or not you're cycling or menopausal, whether or not you're on hormone replacement therapy. So I'm actually taking the context of my client into account when I'm translating or interpreting her hormone levels. I'm looking for patterns, not just numbers. Is your cortisol spiking at night, keeping you awake? Is your progesterone low relative to estrogen, driving things like anxiety and heavy periods? Is low testosterone contributing to your low libido and low motivation? This is about whether your hormones are supporting your energy, mood, and metabolism, not just sitting in the normal range. And next up, we have homocysteine. If you're starting to worry about your brain, maybe you're having issues with memory, focus, or you have a family history of heart disease and stroke, homocysteine is a marker that I don't want to skip. Most doctors don't check a homocysteine on routine labs. So early warning signs can be missed. So I do check a homocysteine as part of a broader look at your cardiovascular and your cognitive risk and how your body is methylating, meaning how your body processes B vitamins. That matters because elevated homocysteine is linked to increased risk of heart disease, increased risk of stroke, cognitive or brain decline, memory issues, and problems with methylation and B vitamin status. So I generally like to keep homocysteine levels under 7. If it's elevated, it's a sign we need to support your body more deeply. So I'm not totally against conventional medicine. They are excellent at diagnosing disease like heart attacks, strokes, diabetes, advanced thyroid disease. It's not designed to catch dysfunction before it becomes a diagnosis. I know this because that's how I was trained. And that's why you can feel awful, be waking up at 2:30 in the morning, gaining weight, snapping at everyone you love, and still be told everything looks normal because you haven't crossed that threshold into disease yet. So I personally dig deeper because you deserve to thrive, not just survive, and be told that everything's just fine. So remember, if you want all 15 labs I recommend for women over 40, plus the optimal ranges that I look for, I've put everything into a free lab guide just for you. You can grab that using the link in the description below. And if you're tired of feeling dismissed and you're ready for someone to help you connect the dots between how you're feeling and what is showing up on your labs, you can also use the link that's in the description to book a strategy call with me. This is what I do. I help women over 40 get real answers and real results. And with that, we're going to see you right back here next week. Ciao.